Hey everybody, welcome back. So today I wanted to chat about why I did not do a research year and why I'm really opposed to doing research years. So, as I mentioned, applied to ortho, didn't match, choked on step two. Biggest other deficit that I could identify at the time was lack of research, lack of pubs, and my application didn't really highlight that I had like a future in doing research as a resident or publishing, or being like a robust publisher, which many places want, or they just want to see that you are able to have done research in the past, or you're able to do research because maybe it shows scientific curiosity or the ability to keep up with the literature or something. I mean, I realize now that research is important, but a research year after going unmatched is something that I think I'd never do, even though I did consider it. So the first reason I didn't do it is I needed a job that paid the bills. I'm married. I need to support my wife. Maybe I was going to have a kid. I didn't want to be borrowing money from my parents. This is something like a personal thing. There's no research year that I found that pays as much as residency does. And you might think, well, as a research year, when you're doing a research year, you're not working as much as a resident. But I'll touch on that in a second. So yeah, the job, the money, that's a big thing. And then as a resident, you have a real contract. I think the research year contracts are not as solid as being a resident. So let's talk about the hours. So if you go to an ACGME approved residency, you're protected by duty hour restrictions. When you go to a research year, it's just you and your PI or whoever's in charge of you, and they are in charge of you. There is no like formal, approved, regulated way of measuring your performance. It's publications, it's how much they like you, and it's their recommendation letter that's going to get you matched or not matched. So I actually did interview for a research year before I transferred residencies. It was an ortho research year, robust academic institution in sports, the thing I enjoyed most in ortho. And I went through like multiple interviews. First it was all of the research fellows interviewed me, and then I interviewed with the attending who was in charge of the whole program. So I'm talking to him on the phone, and he's talking about how you have to have a passion for this type of thing, and I was like, yeah, like I'm willing to dedicate like 10, 12 hours a day, 6 days a week, because I was thinking, well, it can't be worse than residency, right? And he was like, he kind of paused, and he was like, wait a second, you have to say when you interview for something like this that you're willing to do whatever it takes, that you're willing to work for as long as you need to for the work to get done. And I was kind of like thunderstruck. I was like, what? What are you talking about? Like 10, 12 hours a day for 6 days a week? I mean, that's pretty decent. That's like a lot, But, to him, it wasn't enough. And I didn't get the spot because of that. He literally told me, I can't offer you the spot anymore. I was excited until this moment. And when you go forward, you ever interview again, you have to tell people, and you have to be willing. You have to decide, like, you're willing to dedicate whatever it takes. And so, to me, it's so crazy. It's mind-boggling that I know people who've done a research year, who've been in that environment where they basically have to do whatever it takes. And maybe I'm wrong. I mean, I didn't do a research year, obviously, but if you've done a research year and you think I'm totally off, feel free to comment below. But some of these people, they still didn't match. I know more than one person, especially in ortho. That's what I know most. But I've seen it in neurosurgery. I've seen it in urology. Did a research year, did not match after the second time in their desired specialty after publishing so much in that specialty. It's just too risky. It's too risky. Let me tell you, more about why it's too risky. First of all, there's no potential to continue on your training. Like, let's say, for me, I did a surgery prelim. I could have went into general surgery, ortho surgery. I know people who went into plastics after a surgery prelim. Or I even know someone who started off, didn't get it, they wanted like a surgical specialty, they didn't get it, started as a second year family medicine resident. And you might say, well, oh, that sucks, like family med or primary care, but you were supposed to be a surgeon. It's better than doing a research year, not matching, and then starting as a categorical PGY1 internal medicine or PGY1 family medicine. The time. So that potential to continue on to training, it's just like, it's such a draw to doing a surgery prelim or any prelim program, or at least a TY. And I'll do a video about TYs versus surgery prelim versus IM prelim. The other thing is, when you're doing a research year, you're probably gaining a lot of experience and a lot of skills, and you're probably doing a lot of networking in the non-clinical setting. Okay, but the truth is, and I remember when I interviewed for this position, I also asked like, when can I join you in the OR? And he was like, yeah, that's like at the end of the year, like at the end of the year when you're matched. And you're about to start residency and you just need to refresh your surgical skills. So it was like pretty clear cut, like, this is like a research year is a research year. It's not advertised unless you find something, which I rarely see, and I've looked on OrthoGate, I've looked on other websites, I've called programs, I've emailed program directors asking for a research spot. These things are research years. They're not clinical/research. They're not, sub-I plus research year. So so basically what I want to mention is, when you do a surgery prelim, or you do an internal medicine prelim, or you do a TY, you have the potential, and I'm using this word pretty carefully. You have the potential, if you work hard and you play your cards right and you put yourself in the right position, you have the potential to really learn some real doctor skills, okay, and work as an actual doctor and actually treat and help patients and fulfill some of the desires, some of the passions that you want, assuming you want entered medicine because you want to help people. You have that impact, and I definitely feel, even as a surgery prelim, even when even though it's general surgery, it's not my heart's desire, I've definitely had a positive impact on patients. I've definitely contributed to saving a patient's life, which is gratifying at the end of the day, whether you're interested in that type of pathology or not. But on top of that, if you don't match the next time around, you've completed 1 year of training where you can work in urgent care or whatever, you have experience, and you're networking in the hospital with real doctors who are working with a chair, with whatever. It's not this like theoretical type of deal. It's like you're in the hospital, you're meeting doctors, you're calling consults, you're networking with other residents, you're meeting program directors from other specialties. In my case, that's something I did. I played pickleball with the family medicine program director, I remember. And in my mind, I was like, okay, now I have like a third, fourth option. I have something. So that's the reason I didn't do a research year. If you're someone who has nothing to lose, you're in zero debt, someone's willing to fund you, research year paid $25K or $28K is the highest I found, probably $34K. And it's crazy. I talked to this kid. He was like, yeah, I worked this much. This is how much I got paid. It was like $33K a year. And I just talked to him like a week ago. We rotated together in ortho trauma for 4 weeks. Talked to him together a week ago. Reapplied to the match. He didn't match first time. Reapplied, got into emergency medicine. After doing a research year. Can you believe that? So now he has to start over. Whereas in my case, I had the option to reapply ortho. I had the option to reapply to any other specialty that needs a prelim year, like ophtho, derm, radiology, whatever. And at the same time, I had a backup. And the backup that now became, because here's another thing. You're doing the research year. If you're going to get any clinical exposure, it's just going to be orthopedics. But I'm doing my prelim year. I got exposed to radiology. I got exposed to pathology. I got exposed to internal medicine even. I got exposed to everything that I wanted to be exposed to. So now I have a sincere passion for radiology. And I'm, what's the word I'm looking for? Like, I rolled with it. I went with it. I ran with it. But if you did a research year in ophthalmology, or if you did a research year in neurosurgery, that neurosurgeon attending that you're grinding data for and publishing for, can't give you exposure to other stuff. They can only you're basically putting all your eggs in one basket, and it's a risky basket, I think.